Hi, Dr. Sean here at Alaska Healing Arts Chiropractic and Rehab, and in this video we're going to go over a portion of our intake exam for auto accidents and what it would look like if we're ruling in or ruling out a cervical sprain strain or a possible whiplash injury. Let's go ahead and get started. So we're going to have our patient just go through some active range of motion. So we're going to go chin to chest, just seeing what that looks like, any pain. We're going to look up towards the sky, see as far back as we can look. Good, straight forward. We're going to look all the way over one shoulder. Good, and all the way over the other shoulder. We're just looking for limited range of motion, any pain, any discomfort, any reproduction of the symptoms that they're experiencing. Next, we're gonna go through some resisted range of motion. So I'm gonna have her tuck her chin down, say, I want you to hold it there and don't let me pull back. Good, and relax. Next, we're gonna go off to one side, tuck the chin, hold there, and don't let me pull back. Good, relax, go the other direction, tuck the chin. Don't let me pull back. Good, now we're gonna do resisted rotation. So we're gonna look one direction, don't let me pull. Good, relax, don't let me pull. Good, and relax. Next, we're gonna move on to some passive range of motion. All right, so we have our patient face up on the table and we're gonna go through passive range of motion of the cervical joints. So we're gonna start with some easy flexion. We're gonna make sure she stays nice and relaxed so that we're not using the muscles during this, and we actually get to see if there were any ligaments in the neck or any structures in the spine that were damaged in the auto accident. So we're gonna tuck the chin, bring it up as far as we can, testing the ligaments on the back of the spine. We're going to turn all the way one direction and test out to see if that reproduces any pain or discomfort, looking for anything at that end range of motion in any of those joints. Again, now we're going to look any pain or any discomfort when we're doing any of these motions, and then we can also use our palpation to do that same thing. So we can go in and we can take each joint and challenge it at end range and see if, okay, do we produce any of those symptoms at that end range of motion? If so, that might help us rule in a cervical sprain strain accident or possibly a whiplash. There's one last test that I'll do for an auto accident case to make sure that we're looking at any instabilities that might be there from functional instabilities that might be there from the auto accident. It's called a Joule's test. So what we're gonna do is we'll support our patient's head and stay nice and relaxed. I gotcha. We're gonna drop the headrest down and we're gonna bring the head to basically right where all the spinal joints are in neutral position. We're gonna say, can you hold your head right there? And we're just gonna kind of let go and give her some space. What we're looking for, you can go and relax now. What we're looking for is, do they feel like they want to drop their head or they start to shake right away? Obviously, we are not going to do this with someone that we have suspected a cervical instability or a cervical fracture from the auto accident that we would have triaged out in the history or in the beginning of the exam. So we're really testing for more of that functional instability, any weakness in those deep neck flexors, and that could be something that we're working on later stage when we're starting the active rehabilitation process. Alrighty, if you have any questions, feel free to reach out and we'll see you next time.